Hello, my name is Roberto Fedrigo, and I am a fourth-year student in the Honors Biophysics program here at UBC. Today, I would like to discuss the research that I conducted at the Quantitative Radiomolecular Imaging Therapy Lab, also known as the CURATE Lab, at the BC Cancer Research Centre. Overall, my project was focused on using phantom experiments to guide how we deliver prostate cancer imaging. Firstly, I would like to start off with showing you a patient with metastatic prostate cancer who unfortunately was not responsive to standard therapies, and under normal circumstances, they would be considered terminally ill and destined for palliative care. However, with a new type of therapy called PSMA radionuclide therapy, this patient was imaged 8 months later and they showed significant improvement. And this was not just a single outlier case. This was actually one of many patients who responded incredibly well to this treatment in a clinical trial. So what exactly is this therapy, and how can we use PET imaging to revolutionize how we deliver this treatment? And in order to understand why this therapy is so effective, we need to look closer at interactions at the cellular level. It has been found that over 90% of prostate cancer patients highly express a protein called PSMA in the cell membrane of their prostate cancer cells. And researchers have designed molecules that selectively bind to PSMA, which we call targeting agents, and then attached a radioactive atom, such as fluorine-18, that can be detected with a machine called a PET scanner. Collectively, by injecting this molecule, known as a tracer, into a patient, we can detect tumor cells in the human body. But if we want to shift our mindset from simply diagnosing patients to providing therapy, we can change the radioactive atom for lutetium-177 or actinium-225, which emit beta or alpha particles, respectively. Beta and alpha radiation causes significant damage to the nearby tumor, and that is effectively how PSMA radionuclide therapy works. As one might expect, it is very important that we are able to carefully detect and quantify tumors prior to delivering this type of treatment. And positron emission tomography, also known as PET, is the most sensitive technique that we have for diagnosing cancer. And so, as a result, it is very important that these PET scanners are properly calibrated using an object known as a phantom. Phantoms are objects that we fill with known concentrations of tracer, which are subsequently scanned with the PET scanner. And the phantom in the bottom left image, known as a NEMA image quality phantom, for example, allows for very reproducible quantification and comparison of the scanners, but it does not do a very good job at approximating the anatomical structures that you would see in a real-life patient. And so the aim of my project was to develop a phantom study that realistically represents physiological conditions and use it to improve how we image prostate cancer. For comparison purposes, I would like to show you two images. On the left, we have a PSMA PET CT scan of a prostate cancer patient. And on the right, we have a CT scan of a highly sophisticated phantom that we used in this study. As you can see, the bone structures as well as general shape of the phantom resembles a real patient remarkably well. Here is another view of that phantom from a three-dimensional perspective. As you can see, the phantom has a realistic torso as well as a rib cage and spinal cord. The phantom also includes internal organs such as compartments that can be filled to simulate a liver, which is the bottom left image, as well as lungs, which is the bottom middle image. Since the aim of the project is to investigate tumors in prostate cancer, we also included compartments that can simulate the bladder as well as ureters, which are the tubes that connect the kidneys to the bladder. All of these organ compartments can be filled with specific concentrations of a tracer called FDG, which is glucose that has been tagged with a radioactive fluorine atom. Next, I would like to provide a large-scale overview of how this experiment was carried out from start to finish. Firstly, I analyzed the tracer distributions found in PSMA PET scans of real-life patients so that we can replicate the same tracer concentrations in each organ of the phantom. Next, we injected epoxy with a different, longer-lasting tracer called sodium-22, which comes in the form of radioactive table salt. The radioactive epoxy was molded into tumors that ranged in size from 2 centimeters all the way down to 3 millimeters in diameter. Next, 27 of these tumor models were inserted into the phantom in locations that you would commonly find prostate cancer metastases, such as the abdomen, pelvis, and mediastinum, which is the region between the lungs. Once these lesions were inserted into the phantom, radioactive glucose was injected into each compartment. Once the phantom was ready to go, we placed it inside the PET scanner and performed a PET scan running overnight, starting at midnight and ending at 8 in the morning. These images were then reconstructed with two different image reconstruction algorithms. Firstly, with OSEM, considered to be the gold standard algorithm in PET imaging, and secondly, with BSREM, which is a new and very promising reconstruction method, which has something called a beta parameter that the user can manipulate. Finally, once these images were reconstructed and the analysis was complete, it is important to note that the final step of the phantom experiment is to translate these findings into meaningful information that is useful from a clinical perspective. On the left, we have a PSMA PET scan of a prostate cancer patient, and on the right, we have a PET scan of the phantom. And if you view a time-lapse video of this phantom over the course of the 8-hour scan, you can actually see that the radioactivity in the main compartment decays much faster than the sodium-22 activity in the tumors. As a result, the tumors become brighter and brighter. And if we take an additional scan of the phantom many days later, the background has decayed completely, and so we are able to see the tumors under ideal conditions. And the main goal of this study is to see if we can reconstruct the images in order to perfectly view these tumors. And as you can remember, the scans were reconstructed with that new BSREM algorithm, and the beta parameter was manipulated. And what we were trying to see with this beta parameter is whether we can recover the true concentrations of the tumors. As you can see, for the lesions from 10 to 16 millimeters, the beta 300 parameter approached 100% recovery. So it appears to be the best recovery parameter for the large lesions. However, for the smaller tumors, the beta 100 value in dark blue is best because it's the value that approaches the 100% recovery fastest. And if we compare the BSREM algorithm with the beta 300 value in blue against the conventional OSEM algorithm, you can see that it gets much better recovery for the 12 and 16 millimeter tumor sizes. In summary, we designed a highly realistic phantom experiment that uses anatomical compartments such as the liver or bladder, and those compartments were filled with a concentration of tracer that simulates what you would see in a PSMA PET scan. Next, we use this phantom scan to optimize how we reconstruct images to get the most quantitatively accurate tumors. Notably, we found that higher beta parameters should be used for larger lesion sizes. In the future, we can expand this experiment across North America to include sites such as Stanford or Johns Hopkins, so that all sites have synchronized baseline values that can help for comparison of clinical trials in a meaningful way. Finally, all of these experiments will be used to provide clear recommendations for clinical trials and standard of care, and hopefully make an impact in the lives of patients with prostate cancer. Lastly, I would like to thank my supervisors, Dr. Carlos Uribe and Dr. Armin Ramim, for welcoming me into the Curate Lab and for providing me guidance and support throughout this project. Thank you for listening.